Welcome, listeners, to the 167th Olympiad of the Two Vets Talk Pets podcast, where too much talking of pets is barely enough. I'm Dr. Robbie Anderton, and I'm joined by Dr. Juan Antonio Lewis Kirkham Samarantz. Lewis Kirkham. Lewis, how you going?
Good, Robbie. How you doing, mate? It is. It's the Olympics, isn't it?
It's Olympics. It's ring
Olympics
time.
It is, isn't it fun? Hey, isn't it fun just watching all the different sporting events that you've just forgotten the rules about, and then they bring you back the hockey, and you're like, oh, that's a good game, hockey, but I don't understand the rules.
No idea.
No.
Or fencing as well. You know, I mean, when I was a kid, literally had no idea where it's sword fighting. Why are they calling it fencing? Isn't fencing what the guy does when he puts a fence up between the paddocks?
That's right. Exactly. You're spot on. And also, where's the urinal? We're sword fighting. Where's the urinal there? Just two grown men sword fighting. Yeah.
Just
rules.
Just what happens. No.
Taekwondo.
Parry, thrust.
Yeah. That's right. Taekwondo, it's fun. Just kick each other. It's good.
I did Taekwondo when I was a kid, back before it was an Olympic sport. I mean, had it been an Olympic sport, Lewis, back when I was doing it, I might have kept on going.
It could be two vets talk Taekwondo, mate.
It could be. Yeah.
Or one vet talks Taekwondo and the other one just talks being a vet.
Yeah. But why not? Why not? It can't be any less relevant than what we talk about anyway.
Exactly. Speaking of that,
Oh, the other thing that always got me in the Olympics was, we're being from Victoria, where we've got football, where you use more than just your feet, and then you watch the Olympics, and they've got football, soccer, where you're actually kicking it with your foot, and then handball, you actually pick it up and throw it with your hands, and it's like, well, that obviously makes a lot more sense.
It's confusing. I've been watching a bit of the women's soccer.
Oh,
yes.
I
love it. And you know why I love it? The skills are amazing, exquisite skills, but I love it because they don't dive. If they fall over and they hurt themselves, they've hurt themselves.
Yes.
There's taking the big dive that you see in the men's. They roll around until they get the free, and then they're up and ready to go again. Whereas
the magic spray comes out. Yeah. There's it's amazing how the affliction of man flu doesn't just happen, out in real life. That it seems to happen out on the football pitch as well.
Exactly, mate. Anyway, let's get on to the show. What's been happening this week?
I've had a massive week this week. We've had I've had a vet locked down because they had they saw a client last weekend. So that went to the rugby. So this is a couple of weeks, for when people are listening to it. Yeah. Had a client that came in at the time of before the rugby went from tier 2 to then tier 1.
Yes.
So then she was advised that she had to lock down. So she's out for 2 weeks. We've had a nurse get locked down because someone from their building has tested positive. So she's gone into lockdown as well. So I've just finished work today, 6 days in a row after having come back from holidays, worked it out, 54 hours of work this week. So thank goodness we don't open on Sundays anymore.
Oh, that's a big week, mate. That's a big week. Well, I was meant to work today myself, but we got a power outage down in Bay Street in Port Melbourne. So we said, well, there's no point. We can't run the clinic without any power. So we shut for the day. So I was like,
hey. Gee whiz, yabba dabba dooed it out.
I know, exactly. But interesting, you bring up the COVID stuff. I had sort of one interesting phone call during the week. Someone rang up, just returned their call. They had a question. Basically, they had a neighbour who, I'm not sure how, but they'd ended up being in a tier 1 environment. So they had to go into 14 days of lockdown inside their apartment. And they had a Labrador in the apartment with them on their own, and they had no one else. And they couldn't take the dog out for a walk or even out to go to the toilet.
Oh my goodness!
Because they, obviously they're locked in their apartment for 2 weeks. Not allowed to go anywhere. So a friend or a neighbour said, would it be safe for me if I took the dog on, or am I going to potentially catch COVID from the dog, from the owner?
Right.
And so I had to ring up and I said, well, if you listened to podcast
131 would have been about the time of when, or probably 100. Well, actually, no, as we're supposed to be recording our 100, so it probably would have been, about episode 99.
Yeah, 99.5 probably with Deb in it. Yeah, yes. But and I said, and they were genuinely concerned that, if I take this dog into my house, is there a chance that I could get COVID? And I sort of talked about it. I said, well, you can't, there's no studies to say that you can catch COVID from your pet, which we've talked about before. I said there's a very small risk that if they handed you the lead, or I said, actually there's probably more risk of you going to the door of the apartment and taking the dog from them, meeting the owner face to face, even you're masked up, whatever, in that sort of environment, than there is of you actually having the dog in your apartment. She said, well, actually what we're going to do is I'm going to stand at the other end of the foyer down the apartment. The owner's going to open the door, going to take the collar off the dog and release the hound.
Yes.
And then I'm going to catch the dog and it's going to come and live at my house for 2 weeks until it's over. And I said, I think that is perfect. Good on you for doing that.
I've got a different way that they could have done it as well, which, if you can go back into your DeLorean and change it, they could have Hansel and Greteled it. Yeah, she could have left like little bits of food leading from the door out to the lift, right?
Yes.
So if they're on, say, the third floor or something like that, so she can sit there with the door open. The dog then runs in and then on
bit
goes.
Bit of peanut butter on level 2.
For the ground level.
Lick, ground level. Presses the button.
Down you go, because it's COVID. So that no humans have been touching, because they've been touching with their elbows. So the dog can then go down. Hansel and Gretel still out with some little liver treats out the front, and then away you go.
Fantastic.
Perfect.
That's great. I'll suggest that to the next phone call.
Next time, yes.
And also I had a second one that a friend brought in a dog. Again, dog's been locked down. Owner's in lockdown. Been to the rugby union game, similar to your
the client that saw Jane.
Yes, yeah, and they and the dog had a little bit of a rash on it, and so they're really worried about it. So a friend had gone round, picked up the dog, come in to see me. We talked to the owner on the phone. Dog was fine, no problem at all. But then, interesting, they went to pay. And we said, oh, look, we can do payment over the phone. She said, oh, actually, I've got the credit card here. And she pulled the credit card out in a plastic bag to tap on the thing. Like, I thought, well, hang on, who's touched the plastic bag? I didn't go into the whole Fomite thing and what it could have been, but it was just an interesting sort of
There's a plastic bag, and the credit card was inside some hand sanitizer that was in there, and that was in a second plastic bag that had more hand sanitizer on it.
Yeah, and they double glove to pass over the plastic bag to ungloved and reglove. Yeah, no. So interesting. Yeah, interesting. COVID certainly seems to be affecting us a bit more closely this time, mate, than it has in the last time. And of course, we're still in lockdown here in Melbourne. Hopefully, only for a couple more days.
Yes, yeah. Fingers crossed, man. It sounds like Sydney's absolutely copping it in and out of every orifice. But hopefully we might be right for this weekend. But then it all depends as well. I don't think they're going to let us get back to where we were at 2 weeks ago either. I think it's just going to be a very gradual release,
Exactly. And I really feel for our listener in Sydney. I really feel for them being
absolutely. Yeah.
Our listener. Yeah.
Hope they are doing okay. Trawling back through our back catalogue, going back to episode 99.5 to hear about when we first started talking about COVID. So just to, bring things, back in with relevance of all these addendums and stuff that we were doing, Lewis, I alluded at the last time with our addendum that I'd actually had a suspected case of endospacine toxicity in a dog.
Wow. So this is for the listeners just sort of catching up. This is the pet food, raw pet meat issue that we've had down in Melbourne.
Saga. Yes, controversy.
Been coming from Mafra. It seems Mafra meats, raw food being fed to dogs who then, unfortunately, some have died from or got very sick from liver failure. And we think it seems to be, or it is linked to toxin endospacine from eating a plant from an Indigofera species, which seems to be originated from Northern Territory. So somehow these animals that have gone to this knackery have gone into the pet food chain. So that's a little bit of a circle around, mate. So unfortunately, you've had one, have you?
Yeah. So it was a bit of a weird one, like as these ones that I'm sure it would have been for any of the vets around that have that have seen these cases. So the dog that we had, she was a 13-year-old Kelpie cross that I've been seeing for a couple of months. Yeah, she's an old dog. She's got arthritis and she's on other medications and things like that. And she came in to see me on the Monday, and sometimes with dogs, you'll smell, when they come in, you can smell like a really high, sort of urea smell. And you think,
Okay.
you get the smell, you go, oh, it smells like a urinary tract infection,
Okay.
So I said, look, mate, let's try and get because she was just a bit off food and, just seemed like she was eating, but just seemed a little bit off. And I said, look, let's try and get a urine sample because she's been a little bit incontinent lately. Had a look and it looked like there was a whole lot of bacteria in there and red blood cells and stuff. Go, looks like a urinary tract infection. Here's some antibiotics. That should sort her out. Let me know if things aren't going right, and we'll check her out again.
Yeah, yep.
So then Wednesday, so 48 hours later, the owner rang up saying, look, she's really not eating at all, and I'm a little bit worried. Come down. We'll check her out. This is the thing. Something's not right, so we need to check and see what's going on. So she came in on the Wednesday, and from where on the Monday she looked fairly normal and seemed like everything was going okay. On the Wednesday, she was absolutely bright yellow. She was jaundiced in the eyes, jaundiced in the mouth, like so. All of her mucous membranes were yellow,
gum color. Yeah, right. Wow.
She was so. That's when you go, oh crikey, hang on, something bad's happening with the liver here.
Yes.
And she wasn't like, I know she wasn't like it 2 days beforehand because she's actually got a little lump on her eyelid, and so I'm always looking at that eyelid, and so I flick the eyelid up to have a look at it, so I know the whites of her eyes were still white at that stage.
Yes.
The owner brought me in a urine sample and did a urine dipstick. And one of the things that we test for on the urine dipstick is bilirubin being the bile pigment. Now, I did a urine sample on her on Monday, and there was no bilirubin in her urine on the Monday. And on Wednesday, 4+. So it was absolutely chockers with bilirubin.
Gosh.
And I said, oh my goodness, this is not looking good here. Something's happening with your liver. We'll get her started on a drip. Talking to the owner, do you have chickens or rats? Well, I do have chickens, and there are some rats hanging around. So suddenly, hang on, could this be lepto?
Yeah, leptospirosis. Yes.
So leptospirosis. So zoonotic disease. So therefore, we better start being very careful. Everyone, gloves on. Ash, who's pregnant, you're not going near the dog. You stay right away, and all that sort of stuff.
So leptospirosis, we have talked about before. There's occasional outbreaks we get around certain areas, Sydney, Melbourne, that sort of thing, which is basically spread by sort of, I suppose, rat urine generally. Getting into dogs, something a dog's drunk or eaten or something like that. So and very similar signs.
Potentially can be spread to humans. So that's the reason why it's so important.
And make humans very sick as well. Yes,
absolutely.
Yep.
So ran the blood tests, and then I sort of thought, what? I think so I rang up the owner and I said, look, I'm really worried there's something bad happening with this dog's liver. What do you feed her? And I said, have you ever fed her any raw meat or anything like that? She said, it's actually, I've got raw meat that I get. I buy it from a place in Listerfield, just bits of cubed meat. I actually bought a new bag on Saturday, a fresh new bag, and gave her a couple of bits on Saturday.
Wow.
I said, oh, do you know where they get it from? She said, well, look, I made sure, and they said that no, it hasn't come from the place where the problem with the meat was. I said, oh, okay, right. Do you know where what was on the package? And so they gave me the name of a company from Dandenong. And so I might actually just call them up. And so I called up that company in Dandenong, and I said, look, where do you source your meat from? And they said, Maffra Knackery. So what that means is that my client's dog, who bought the stuff from Listerfield that had come from Dandenong, had actually been originally sourced from Maffra. And we're trying to work out when that food's going to have come from. They've actually, they said it probably came through to us in the first or second week of July. So that's sort of right at the end of when the recall has ended up happening. And so this was all like probably, this was the day before the recall officially happened. So, so this dog, we're trying to do all the supportive things, had it on a drip, giving it antibiotics because, again, is it lepto? Is it a liver infection? Who knows? anti-nausea medication because the dog's just vomiting left, right, and center and salivating and feeling really crummy. Treating her for pain. And so that was on the Wednesday that we started that. On the Thursday, she was stable-ish, in that she hadn't gotten any worse, but she was still looking pretty yellow. On the Friday, we then did another blood test, and her liver enzymes had actually come down, but I think that was because her liver was so bad, because all the things that you look at for liver function had all gone down as well. So her total bilirubin, that bile pigment, had doubled in amount. So she'd gone from 120 to 240 odd. All the other signs that you look for liver dysfunction, urea, which is the nitrogen waste product, glucose, so your blood sugars, and also protein were all down. And the dog was starting to look like she was getting a bit neurological. So I actually got in contact with the vet down in Bairnsdale who dealt he's dealt with like 35 of these dogs. And I said, look, what's the clinical course that you've seen with these guys? What have you seen in the ones that have survived to the ones that haven't? Because I'm really worried that this one's looking bad. And he said, well, the ones that survived were the ones that looked pretty happy, but they just weren't eating. The ones that were looking really bad and really unwell, they usually either died themselves or they had to be put to sleep. So I spoke to the owner and said, look, this is where we're at. I think she looks like she's getting worse. We can go and put a feeding tube into her and we can try and do all this stuff, but her prognosis is pretty poor. And she's an old dog and she's been a chronic cougher. And so she's got all these comorbidities as well. So in the end, we ended up having to put her to sleep. But what we've been able to do was that, the Department of Agriculture have been fantastic in sort of helping out, because they're helping us out with doing testing on her for the indospacine toxin. So we're actually testing her blood. We've got samples of the meat, both the current bag and the previous bag, because the owner had it frozen and had it separated in the freezer.
Okay. Oh,
so we're able to test both of those. Also then, after she'd passed away, the owner consented to collecting some post-mortem specimens. So we've actually collected all, some liver, some kidney, some spleen, pancreas. So that's actually gone off as well for analysis, so that we can try and get a definitive diagnosis.
That's so sad, mate.
It is
really close to home to have one of your patients affected like that. That's
absolutely, and it does just hit home as well of, because I thought in Mount Waverley my clients wouldn't, my animal patients wouldn't be at risk of it, because all these animals are down in Bairnsdale, and there was one in Frankston and one in Cranbourne, so I thought we were far enough away, but as it turns out, no, so I straight away, like as I said in last week's episode, straight away sent out an email to all the clients saying, if you are feeding raw meat, stop. Find out exactly where it is from. And I think this is then a lesson for really everyone from now on, of that if you're buying raw pet mince, so not human grade pet mince, if it's something that if it's something that you would eat yourself, you're probably okay. But if it's not something that you would eat, if it's labeled for pet food only and it's raw meat, find out exactly where it is from. Make sure that you can follow the trail of where it's from.
Yeah, definitely. And I guess as well, though, just with even if you're feeding the human grade stuff, there's a reason why we don't tend to eat human grade raw mince or raw chicken ourselves, and that's because there are other bugs in there as well, unrelated to what you're talking about. So, make sure if you do need to cook some of those things as well, is what I usually recommend too, particularly minces and
100%
and chicken.
I don't feed raw food to my pets at all. For better or worse, I don't do it. So
is there a food brand you'd recommend, mate?
Well, funnily enough, Lewis, there is, delicate care.
Tell me more.
And I tell you what, if you've got a cat that has just recently been diagnosed with having a stomach mass that's been electrolassoed by a friend of the show, Dr. Clint, and that the biopsies come back showing that there is mild inflammatory bowel disease, and you're thinking, my goodness, I need to do an elimination diet on this cat because I'm sick of running around and picking up vomit from it. There is a food that you can try, Lewis, and it's called Delicate Care Sensitive Skin and Stomach.
Yeah, right. So Melbourne's a big hit for it, mate. Really?
Absolutely, yeah. So
Good.
unfortunately for poor, Andre sent the cherish, for the cats to have a shot at. But it's like, Melbourne, you are not going near the cherish whatsoever.
Right.
Not for you. So
Yeah, okay.
yeah. So we're
Well,
on the delicate care, sensitive skin and stomach for Melbourne because it's a novel protein diet. It is a delicate care, Australian made, Australian owned. Anything and everything that can possibly be from Australia is Australian in it. Absolute minimal stuff that doesn't come from Australia. Their supply chain, they can follow everything of where everything's come from. So,
and that's definitely an important part of it, no doubt about it. But also the cherish brand, I did get the a free bag, or sample bag, shall we say? It's nothing, and brought it home for Olive. And before it even opened it, Olive was chewing at the bag to get to the food. And when I opened it, crazy for it. Loves it.
Did she really?
I was throwing bits on the ground. It was like they were a treat. She was running around, chasing them, gobbling them up.
Excellent.
Yeah, it's a really tasty
all
food,
over it like a rash. Nice one.
Definitely. Yeah. So certainly, if you haven't got any sort of medical condition that you need the delicate care for, you can head down to your pet shop and get the Cherish brand of food. And please buy more so that we don't have to have Robbie singing at every time we mention it.
Yeah,
on the show, but also well, you need a song for Zilkeen, mate, because that's our other sponsor.
Yeah, Zilkeen.
What rhymes with alpha cazozepine?
Anyway,
Josephine? While you're thinking of that, thank you, Zilkeen.
Thank you, Zilkeen.
Thank you for your product and sponsoring our show. It's great for those mild anxiety problems. Had a client this week that they had a cat that every time they went away, the cat got a little bit upset, and they'd go away for a weekend and would leave them with a timed feeder. At home for a couple of, just a couple of nights they'd leave it. And in each of the time feeder compartments, they'd open a capsule of Zilkeen and just sprinkle it in just to keep the cat a little bit calmer so they didn't come home to a little bit of urine around the house.
Nice one.
Of the cat being stressed with them leaving. So I thought, well, that's a good idea. Yeah.
What a clever way to do it.
Use it in your timed feeder. So there you go. And of course, it's so palatable too. They'll just gobble it down,
munch it straight up. I'm actually going to later on in the show. I want to. I've got a segment that I call the grill, and so I've got a patient that's been on Zilkeen then as well. So we'll cover Zilkeen again a little bit later on. But thank you to Zilkeen, and also thank you to our Patreon supporters. People that have gone to patreon.com and searched up Two Vets Talk Pets and have joined on. And so thank you very much for your support. We do greatly appreciate it. And it's
you can get every episode a week early at the moment. We're doing well, mate.
Right.
That's 2 in a row, I reckon.
Wow.
That you're listening to this hot off the press if you're on Patreon. And
are you then adding on the addendums separately for the Patreon listeners too?
Oh, I'm so confused with all the addendums that we're doing, mate. But yes, I do add them on at some stage. I'm just not sure when. I can't get my head around it. But I was talking to one of the millennial nurses at work, and she was saying that she's big on. She said we need a bit of something to attract people to go to Patreon. And she thought when we talked about me getting bitten by something in Mossman Gorge, and I had a photo of my foot with the actual bite on it, she felt we should have put that onto Patreon, and people would have paid to have a look at a photo of my foot.
Excellent.
Because I think that is a bit of a thing that people do pay for, but I'm not sure that's the sort of listener we're after, is it, really?
So somebody that's got a penchant for looking at middle-aged men's feet that have got eel wounds on there.
Been bitten, heavily sucked on
niche.
By an eel.
Very niche. That's the glorious thing about the internet, mate. If you're looking for a photo of anything, it's there. It's just do you and it's probably safer to put that behind a paywall because let's face it, maybe our Patreon supporters would be interested in that, but if there was somebody that wasn't and they just happen to be Googling middle-aged man with an eel injury on a foot, they may want to pay a premium price, Lewis.
Yes.
So maybe you could have just like if you only want to see the eel foot injury, well then for $100 you can see that, and maybe then you can send them an after photo as well. Maybe your foot in a
how it healed after
How
the
it
bite.
healed. That's right.
Yeah. Well, it's a bit like, what's that movie with Robert Redford and somebody, everybody's got a price. Well, my price is $3 on Patreon.
Oh, Indecent Proposal.
Yes.
With Demi Moore.
Yes, that's right. I've got a price, and it's $2 on Patreon. $2
there
a
you
month.
go.
You can get all the foot shots you want. But
There is
definitely
definitely a niche, definitely a niche website in that. Absolutely.
Spot on, mate. And actually, just quickly, there was a post on a Facebook page I saw this week, which a little bit relevant in many ways. We all subscribe to our things, and I guess a lot of stuff I subscribe to is behavior related or pet related. And someone put a post up. Hey everyone, I'm wanting to help my sister whom is pregnant with preparing for the arrival of a baby in October and how best to introduce and prepare her 3-year-old Kelpie. Would anyone recommend this book or any other resources? Thanks. Excellent. And they put up a screenshot. Would you believe it? My book. Lewis says, Little Skirkham, tell your dog you're pregnant and Central Guide for dog owners are expecting a baby. And they put up a shot of that. And I was like, just sitting on that. And it was nice. I was getting a few comments, it's a great book. This is really nice, and sort of, a few people going, oh, this is another resource I use. And that's fine. And then I thought, all right, let's have some fun. So I've posted on there under my name. I've gone, this book is okay.
And did anybody twig from then that they realized that you posted about your own book?
I've got one person that's gone, okay, this book is amazing. And then nice. And then they've quickly underneath gone, oh, hang on. That dude's the author of the book. So it was a good bit of fun. I actually enjoyed it. A lot of people came on and said, oh, he's the man himself. It was
nice one.
Yeah. It was I thought, people not going to get it. I thought, all right, it's late at night. I've had a beer. Let's do it.
A little loose.
It was. Because I don't normally reply. I do get a little bit of that stuff. I don't normally, reply to that. I don't really want to, or want to, too much. But I thought, oh, here we go, and it was fun.
Mate, there's no better time for a middle-aged man to be hopping onto social media than late at night when you've had a couple of beers. That is perfect. That's when we're at our best.
Oh, and especially after been watching the opening ceremony, and you had a little bit of shut eye.
After you're waiting for Australia to come up 3/4 of the way through.
Oh no, the Japanese alphabet. It was something I haven't studied up on recently, so I was a little bit confused as to when we were coming out.
Oh, trying to explain to the kids of so Greece come out first, and then it's alphabetical, and then after that, then the host nation comes out. Then all of a sudden, Yemen comes out. And what? And then Israel.
Dad, Dad,
what's going on?
A, B, C, D, E.
This is very simple, Dad. I was like, well, you guys are learning Japanese. Surely you should have been able to predict this.
Spot on.
We had I was shagged. I was going to bed at like at 10 o'clock, and the kids are going, oh, Daddy, where do they go? I don't care. I don't care. I don't do opening ceremony. I don't do people dressed up as, I can't do the interpretive dance stuff.
It was different. Yeah, contemporary dance. Yeah, it's not my cup of tea. But anyway, it was a good show. And I before we get on to the disclaimer, I had this little article as well that that I also got probably the same period of time when I was just saying my book was okay.
Yeah.
This is an article. Increased water viscosity enhances water intake and reduces risk of calcium oxalate stone formation in cats.
Oh.
Yeah.
Water viscosity, hard water or soft water?
Well, you just add sump oil to the water, mate.
Nice. That clags it all up.
Yeah, that'd be it. Just go out to your local grease trap, your fish and chip shop, and they got any out the back, just viscous up the water a bit more, I reckon.
I'll have some minimum chips and just fill up this Pyrex jug just with a little bit of your finest deep fried oil. Thank you.
How about that? And so I was intrigued by that. I thought, how does that go? So I like this. I did get the journal article. Very first paragraph, simple summary.
Right.
Perfect.
Good.
I like that.
It's exactly what you need.
I like that. Exactly.
30-second read. Love it.
Exactly. Increasing water take and decreasing urine concentration are recommended for cats that form stony concretions in the bladder
or urinary
tract.
Sometimes we had to get our footpath reconcretioned because when all the renovation was done, the builders wrecked the concretion, so we had to get it reconcretioned.
I think sometimes you have a couple too many of those beers in the evening. The next morning you can have a really concretion, something you need to get rid of. But anyway, the purpose of this study is to determine if water with increased viscosity results in increased water take in cats by taking advantage of the unique anatomy of the cat's tongue.
Oh, right.
And I love this description. This is great. Cats delicately dip their tongue into water, pull their tongues back up to their mouths, and capture the water that follows. Lapping occurs by fluid adhesion to the dorsal, so that's the sort of top part of the tongue's tip, and by lifting a liquid column through the tongue's upward motion before jaw closure. Wow.
There you go.
That's I really like that description. Cats have the ability to balance gravity and water surface tension, ingest the maximum amount of water per lap. This observation led us to question whether changing the properties of water in a way that allows cats to lift more water per lap is possible. Increasing the viscosity of water was accomplished with 1% methyl cellulose.
Oh, okay, right.
Yes,
so
yes.
like a gel, like artificial tears.
Maybe an ingredient that is palatable to cats.
Oh, there you go.
I think it's more like a fiber.
Ah, okay.
I think it's like a natural fiber. It's basically Metamucil, mate. Pretty sure.
Metamucil.
Yeah, pretty sure. Just sprinkle.
Metamucil helps you out with your concretions.
Yeah. Well, we'll just do both, wouldn't it, at once? Exactly.
Both tubes.
Both tubes. You drink more and you concrete less. Cats consuming 1% methyl cellulose water had increased water intake, 25% and 1% higher at 28 and 56 days, respectively. And increased water intake reduces the risk for calcium oxalate stone formation. The benefits of giving cats viscous water is that they can increase water consumption without having to change their natural drinking behavior.
There you go.
And this got me thinking, mate, could we do a Two Vets Talk Pets cat water?
Oh, I love it.
Do you reckon?
Yeah.
What would we call it? Any thoughts on the name? Cat juice,
Agua filanus.
Oh, yes. Nice.
Yes.
Something a bit more catchy, though.
Oh, okay.
Cat juice.
Cat juice. Cat juice. What you get when you squeeze a cat?
Maybe. That's another. Anyway. Not sure, but you might wonder, how do you make it? How do you make the cat juice? Good juice. Fancy should ask that, mate. Methocell E4M food grade modified cellulose was used to prepare the methocellulose water using a high shear mixer, 1% weight for weight,
right,
of methyl cellulose was blended into deionized water.
Right.
During the shearing process, the product was placed under non-atmospheric vacuum conditions.
Excellent. Good. I'm writing this all down. Yes.
Need to borrow your Dyson, I think, mate. Probably need the Dyson for that.
Excellent.
If we're going to do a Two Vets Talk Pets cat juice.
Put the Dyson over the Thermomix so that as it's churning up, we're sucking the air out at the same time.
Yeah. The viscous water was then processed using ultra high temperature conditions. So we need it on the stove.
On the stove.
With the Dyson. And the Magimix, Thermomix,
Thermomix on the, good. Yep. Writing this down, good.
The product was then cooled by flash cooling. So we need a flash cooler.
Good. I thought you were going to try and flash it. And I was going to say, no, that's no good. Maybe we could use an ice water bath or something, Lewis.
Yeah. Well, I think what they mean is when you go to Good Guys or JB Hi-Fi, go, oh, mate, that's a flash looking fridge. I think that's what they're talking about. Just one like those.
Just a flashy one.
Flash looking one, flash cool.
Excellent.
The heating was to 140 degrees.
No, easy.
Yeah, that's easy. Hotter. It's not your kettle, is it? It's a bit warmer, a little bit warmer.
Yeah, a bit hotter than that. Maybe two kettles. Put one kettle on top of the other.
with the Thermomix and the Dyson all in one. So it's a vacuum, shearing, heating and cooling.
Right next to your flash fridge.
Exactly.
Yeah.
The product was then cooled by flash cooling. I said that in a vacuum sealed vessel. So you got to cool it in the Dyson.
Yeah, in the Dyson, inside a like maybe there needs to be another like a really grand sized sealable bag with another Dyson attached to it. So we've got like a Dyson inside of a Dyson.
Yeah, or sous vide. We could sous vide it. That would
we could sous vide.
That would vacuum seal it,
you call
wouldn't
it sous vide or call it sous vide?
Yeah, tomato, mate. Come on. I've got no idea. I don't have a clue. It's all French to me. The product was then cooked. Oh, I said that, and aseptically filled into a shelf-stable packages to maintain all relevant product characteristics, viscosity, and aroma.
Oh, the aroma. Yes.
Yeah,
you got to keep the aroma of that water, proper.
Yeah. I do love a bit of methyl cellulose aroma, 1%. It's just very nice.
Yeah, brilliant.
The measured viscosity.
My nose, I can smell it already.
And as you know, mate, the measured viscosity of 1% methyl cellulose was 282 centipoises.
Oh, yeah.
That's
absolutely.
a unit.
Of course I know that.
Yeah, that's a unit we use quite often. Whereas the measured viscosity of deionized water was 4.9 centipoises.
Oh, that's magnitudes of difference.
That's poles apart, isn't it, mate?
Absolutely.
That's many centiposes apart.
I'm surprised that water's not jumping onto the cat's tongue. I'm surprised the cat even needs to put its tongue in the water.
I think it
doesn't
smells
just open its mouth and it just jumps straight on.
It goes, hang on, is that 282 centipoises water I can smell? Exactly. Exactly. So there we go. So it's interesting. Two Vets Talk Pets cat juice coming your way.
Hey, well, we can take that to the cat show. We can go and get we can have Ron on one side of us and the grass man on the other.
Yes, we'd get some customers there, wouldn't we? Between the
Two Vets Talk Pets talk cat water.
Between the hat and the hat and the grass, we'd be the cat juice in the middle.
I wonder, could you imagine, right? Could you imagine just for a moment? I know I've worked a lot this week, Lewis, so I'm sort of lost my mind a little bit, but could you imagine us having our own little stall there? Two Vets Talk Pets cat water. We've found out that the increased viscosity is going to help to improve your cat's hydration. So therefore it's going to help out with crystals. And so what we have little sample bottles there of our feline agua or agua felis bottles there. And we've just got some antibiotics. Hang on, we've just got to fill up some new stuff. Hang on, I've just got to duck off to the toilet just to fill up some more. Shh, just fill in the little tap.
Turn the Dyson on.
Oh, mate, I'm just talking about just putting it in just normal tap water.
And go,
scan. There you go.
Yeah, no, we would not scan the listener. No, we're not. No, there is no way that a bottled Two Vets Talk Pets cat's juice is going to be a scam, mate.
We've got enough stickers left over, mate. We could just put the stickers straight on. Just put it just straight over the thing of the Woolworths brand, bottled water. Well, Two Vets Talk Pets cat water.
Well, it'd be kind of like that Seinfeld episode. We could have the kids out the back of the stand with the big slab of the Coles, the Woolworths, cheap, water, generic water, drinking the water for us to then take to the toilet to fill up and put a sticker on it and bring it out as cat juice. There it is.
Brilliant,
mate.
I love it. I love it. And then we just have a picture of Olive and Melvin just drinking it. See, look, we wouldn't use this on any cats other than ourselves, our own.
Exactly. Now move on to the guy in the hat. Off you go. Oh, mate. I reckon. You know what though? I reckon you get a good enough marketing behind it. It's got legs. It's got legs, mate. Because there's a study behind it. There's actually a study behind it. Science. Exactly.
And we can say, look, have you ever wondered why your cat's tongues have the little spikes on there? That's because it's there to try and use the water's surface tension to try and bring it up. So what our Two Vets Talk Pets Fila Agualis does is it helps because through its increased viscosity from the 0.1% methyl cellulose actually helps to increase the surface tension, which means that every lap your cat makes, it gets extra in. 50% more water per lap. That's going to dilute the urine. That's going to help out urinary tract infections. Here, would you like a bottle?
Good pitch, mate. Good pitch. And if any listeners out there
want to back us, Shark Tank. Shark Tank.
Yes. Go to Patreon. No, if they've got any listeners. Well, no, maybe we've got a listener who's owns a factory that makes truck it. What's that word? Anyway, makes a lot of it.
I think this podcast's getting a little bit trucked
Yeah,
as
I think
further
so.
we go along.
If they make lots of it,
Yeah.
and they make big bags of 1% methyl cellulose and they want to sell it, we're happy to drink the water and fill it up
Oh,
with
for
methyl
sure.
cellulose. Yeah,
For sure. Let's
get onto
do-
us to
oh.
Vets Talk Pets.
And you know what? I think it actually harks back to the way that that cats' ancestors used to drink water too. You know,
Yes.
I'm certain that the lions in Africa specifically look for the water holes that have got an increased viscosity, so that means that they can actually get more water per lap, just to try and improve their hydration. I'm dead certain of that, Lewis.
Yeah, mate. And that certain of it. Let's go to the disclaimer, I reckon. What do you reckon?
All advice on the show is general in nature, so please consult your veterinarian before following any advice for your pet. Do our best to provide the most up-to-date information, but as veterinary medicine is continually advancing and changing, please let us know if you missed anything or if you need any clarification.
Excellent, mate. Now you got.
I'll leave that one for next week, mate. I think I've prattled on enough. Do you want to do your one or?
Yeah, I can do a quick one. Yeah, so I've got a little article I saw about, and it was quite poignant, I suppose, that I've had a few clients asking me, and I actually had one of the vets asking me about desexing and behavioural disorders, and whether spaying and neutering affects behavioural disorders, particularly in dogs and that sort of thing. And well, there's not a lot of concrete stuff on the behavioural stuff, so I did a little bit of research about it. Sort of, I thought, I've been giving this advice that I thought was correct. I better just check. So this came from the Veterinary Information Network from the World Small Animal Veterinary Congress in 2017. So it's a few years old, but still quite relevant. It's a little bit of a summary paper about, does spaying and neutering affect behavioural disorders in dogs? So the first question is, should spaying and neutering be delayed in dogs for behavioural reasons? So, surgically altering dogs at 6 to 7 months of age has been the standard practice for generations of veterinarians. Within the last decade, evidence has mounted medically and behaviourally to indicate that for some individuals, alteration at a young age may have deleterious effects. With this said, there is a continuing evidence that spaying and neutering reduces relinquishment, so being handed into the pound, and various unruly and sexual behaviours. The purpose of this paper is not to persuade the reader to a specific conclusion, but to present representative studies to stimulate critical thinking and discussion.
Good.
Question 1, does early spaying increase the likelihood of aggression and fear in female dogs? Now, in a study done by Kim, Yon, and Haupt, they found that dogs who were spayed show increased duration and deeper pitched territorial barking.
Right.
So there you go.
Once you desex, there you go.
Yeah, I didn't know about that one. Duffy reported in a survey of 1,500 dogs, owners who were also members of a purebred dog breed club. So they're perhaps a little bit biased in that sort of sample size, that owners of spayed dogs were significantly more likely to report aggression towards strangers, fear of people, and sensitivity to touch. In addition, evidence was presented to support that spaying increases inter-dog aggression, but only in certain breeds. In another survey by the same author of about 3,500 dog owners who visited the author's website to take the online survey, so again, potentially a little bit biased, owners of spayed dogs were significantly more likely to complain of dog and owner directed fear and aggression, touch sensitivity, and fear in dogs that were spayed. But they did say that they did find that dogs that were spayed were calmer, whatever that means. So interesting. So there's a couple of studies there. And there's a little bit on, does keeping male dogs intact protect them from cognitive dysfunction or cognitive decline? Doggy dementia, Alzheimer's. So Hart found that in a group of 76 male dogs, that intact male dogs were significantly less likely to suffer from age-related cognitive impairment. With dogs living well into their teens, more dogs will be at risk for cognitive impairment, and leaving them intact may slow these changes at the end of life. So that's interesting. That's something we don't normally talk about is the chance of keeping your male dog entire will help with cognitive decline. This is an important one, I think, that a lot of people ask. Does neutering male dogs make them more aggressive or fearful?
Yeah.
And I think this is a common one. We think testosterone
Yes.
is linked to aggression. Well, in the same study, 3,500 dogs by Duffy, we talked about earlier, and mentioned it. Owners of male dogs were significantly more likely to report dog and people-directed aggression in neutered male dogs.
Right.
Dogs who were neutered were less likely to urine mark. So definitely that's certainly something we do know, that there's less urine marking from
less lifting your leg and things like that when you're on a walk.
Yep. And inside the house too as well.
Yeah.
And were calmer. So again, we got this calmer thing coming in. The dogs that are desexed, male dogs desexed, were considered to be calmer. Hoodie and Zinc reported significant differences in levels of aggression in intact dogs versus neutered dogs. Dogs who were neutered at less than 12 months had the highest levels of aggression, with dogs neutered at 13 to 18 months being the closest to the intact dogs in aggression level. In addition, fear and anxiety was significantly higher in groups of dogs who were neutered when compared with intact dogs. In this study, the target of aggression and the type of aggression wasn't identified, so it can make it difficult to identify, specific causes. Was it territorial? Was it fear, aggression? Sort of what was the cause? So that sort of flies a little bit in the face of, if your dog's a younger dog and it's starting to show some aggression or fear, you should, and to male dog, you should desex them straight away to try and reduce that tendency. And that's something that I'm leaning more towards. I mean, obviously, there's a lot of things that we need to weigh up, but if I've got a little puppy that's perhaps a little bit fearful, perhaps showing a little bit of aggression, I do tend to say, let's delay it until at least over 12 months of age, if we can, if there's no other reasons for desexing. Sometimes we think that maybe testosterone gives them a little bit of confidence and may help just a little bit with that fear-related behavior. So that's something to consider as well. And then it goes on. However, in all three groups of neutered dogs, the level of aggression and fear was significantly higher in the neutered dogs than the intact dogs. Hart and Eckstein found that urine marking, mounting, and fighting with other dogs were all reduced significantly or eliminated by neutering in 50 to 60% of the dogs. And we've known that for a long time. There was no change in the behavior of dogs who had fear-related aggression and territorial aggression. In a similar study by Marschalke, Verd, and Endenberg et al., 60% of dogs who were neutered showed a decrease in sexual behavior, intermale aggression, roaming, and marking. In 50% of the dogs who were neutered, owners reported that dogs were calmer. So we've got this calmer thing coming in again.
Yeah. Still only, I mean, they say 50%, like it's still a bit of a crapshoot, isn't it? It's not like saying that it's, oh, if you do this, it's going to calm them down.
Yeah, that's more for the calmer stuff. Not sure about the percentage of that. I think that's more for the urine marking and the roaming stuff, known to be about 50 to 60%. Spain, Scarlett et al. Found that dogs who were spayed and neutered prior to 1 year of age were more likely to exhibit noise phobias and sexual behaviors, while they were less likely to exhibit separation anxiety, inappropriate elimination when frightened, and to be relinquished. So that's what we mentioned earlier. It's less likely that they're going to be given up. So in conclusion, they say, we can't make a blanket statement about what is right for all patients. And this is what we've been saying for a long time. Behavior disorders are not of singular etiology, so they don't have a singular cause. It's not a simple switch on and off. Clearly, spaying and neutering any age has benefits behaviorally, eliminating unwanted behaviors that increase the likelihood of relinquishment of giving them up. It is essential when looking at behavioral outcome studies to consider the environmental factors and genetic factors strongly influence behavior patterns. In addition, with the exception of the Yeon study, one of the studies above, the studies here are all retrospective or survey studies which rely on owners reporting, which I think we talked about in the podcast. Well, it certainly talk about a journal club doesn't always give us the best idea of what owners' perceptions and ideas on behavior can be easily, biased or, modified by what they believe or anything at all. Anyone's opinion can be modified. So most studies listed here use the same questionnaire, which is often a problem. As with everything in veterinary medicine, all studies should be looked at critically. Many would say that there is, however, enough doubt that a risk-benefit analysis should be done for each patient when considering when to recommend spaying or neutering. And basically that's saying, talk to your vet. I think that we're the ones with the most up-to-date information that we can assess there's a lot of medical stuff about early neutering and different ages. We've talked about this in the podcast, a few podcasts ago. So, for instance, you've got a fearful young male puppy dog. I might say delay, delay the desexing to help with them with confidence. But then the owners might say, well, I've got an intact female at home, or maybe
I don't want babies.
Exactly. Or maybe, we're starting to urine mark around the house, and then we'll say, well, hang on, we need to weigh up, which sort of way we're going to go. So certainly talk to your vet. There's a little bit of food for thought there, but that's really a quick summary of what the major stuff as far as science says.
Yes. And that's just another thing that we can just talk about in our 15-minute puppy vaccination.
Oh yeah,
exactly. So we're going to desex. Oh well.
Yeah. Or just direct them to episode 162. Vets Talk Pets.
And that's like I've been saying to people now, like particularly with the fact that we're not just blanket saying, all right, we're going to desex your dog at 6 months regardless of what's going on. I try and say to people, you know what? It's actually probably worthwhile coming and having a chat with us at 6 months so that we can actually see where your dog is at and what's going on. It's not just a nice, simple, here's one piece of information and then you're done anymore. It's not, it should be more nuanced. We should be taking more time with when we make the decision. So maybe that's just what we've got to do. And it's about educating our clients as well as ourselves about what are those things that we need to be looking at so that we make sure that we're making a more nuanced approach and a more individualized treatment regime, not just you've got a dog and it's going to be desexed at 6 months. And that's part of the thing of why we've got friends that are looking at getting puppies, and some of them are looking and they've already been desexed prior to 10 weeks of age of when they get them. And it's like, you know what? You then don't get to have that conversation.
There's no choice. There's no choice. Exactly.
Yeah.
Exactly.
If you've got an anxious little puppy and they're 10 weeks old and they're just, once they got chucked in the bin 3 weeks ago, you can't get them back.
Yeah, the testicles. Yeah, I know what you're saying.
Oh, your testicles. Yeah. The puppy's not in the bin.
Not the puppy. No.
Testicles are in the bin.
Whew. Yeah. A bit of a worry there. Anyway, we if you've got any questions about that, you can certainly get on to us, 2vetstalkpets at gmail.com. You can even leave a comment on our YouTube channel, which you might be watching this now, which looks like I'm going darker and darker because the sun is going down.
The sun is going down. Yeah, I'm adjusting my ring light here, mate, so I'm not sort of washing out too much.
Yeah, lovely, mate.
That's how professional I am.
It's gorgeous, yeah. The YouTube watcher, the YouTube watcher will really appreciate that, mate. We did get a couple of comments though that have come in.
Yes.
Helen Chalker.
Oh, Helen. Hey, Helen.
There you go. It says, Lily the cat loves watching you guys on the TV.
Awesome.
Gigi, her brother, is yet to be convinced.
Yeah.
Perhaps roll a ping pong ball across the table. Nice.
Oh, there we go. We could definitely do that. Well, maybe he'll enjoy seeing Ruben standing there over my left-hand shoulder with his orange in his mouth before.
Yes,
at about the 55-minute mark. We'll see whether or not that gets him across the line.
That was very cute, that old gag. And then she writes, or Deb could guest host.
Oh, of course Deb could.
Thank you, Helen.
Right, Helen.
We haven't had that
suggestion. No problems with that.
We haven't had that suggestion for a while, Helen. We'll take that on board. We did have Deb on last week's podcast, so or the week before. Anyway, we're up in Port Douglas, but a guest host. That's an interesting thought. Thanks, Helen. Thanks.
Why not?
And then Suzanne Baker, Decal Gal.
Hey,
is back. She's left a comment. Hey, all. Glad to see you all on the tube.
Yeah.
Maybe Deb can be a guest soon.
Oh, of course she could.
Now, for those people who think I'm making this up, there is right there. I've printed them off,
black and white,
and you can see for yourself if you're on YouTube. They might be around the wrong way. I'm not sure.
No. That's coming up all right on my feed.
That. Yep, you can see that has not been written by me.
No, not at all.
We have to the listeners, the two listeners,
Suzanne
that we've had.
Hey, that's getting more. It used to only just be one person asking every couple of weeks. Now we've got two in a week.
Or we'd make them up ourselves.
We've got to give the people what they want, Lewis. And just as maybe Helen will be interested in getting some of our 2Vets Talk Pets cat water,
the cat juice.
Felis
aquas.
Yeah,
we've got to work on
Felis aquas.
Felis aquas. What about cats? I can't think of anything else. All righty, guys. That's a wrap, I reckon.
Absolutely.
Scratch you later.
Peace out, everyone. Bye.